Using the right tool for a job can make a big difference. Yet if I had to figure out on my own which tool to use and when, it might take a lot of trial and error. Today I'm going to give you clinical tips on what interventions are best for testing common types of thoughts. There are three types of thoughts that we commonly test in CBT: automatic thoughts, underlying assumptions, and core beliefs. We actually have different interventions ideally suited to each. Automatic thoughts are the thoughts and images that pop into our head moment to moment throughout the day. We have thousands of them every day. The automatic thoughts we're interested in therapy are those that trigger the moods and behaviors that we're trying to improve. The best interventions to test automatic thoughts are those that help the person look for evidence in the situation where the thought occurred. Some automatic thoughts are ones that just occur in a given situation. For instance, I might have a thought, the dinner I cooked last night was a complete disaster. For situation-specific automatic thoughts like these, we can simply use Socratic dialogue, a few minutes of conversation, asking more information about the situation in which the thought occurred, and looking for evidence that supports and doesn't support the hot thought. When the same automatic thought comes up over and over again, then a different intervention will be better. Continuing with the dinner example, it might be a thought like, I can never do anything right. For these types of recurring automatic thoughts, the 7-column thought record, which I developed in the 1970s, and which we teach people how to use in the Mind Over Mood workbook, is a much better intervention. The 7-column thought record teaches people to test out the hot thoughts and images that drive their moods and behaviors. If most of the evidence supports a hot thought, then we help people make an action plan to solve or change the problem. If only some of the evidence supports the hot thought and there's an equal amount or even more evidence that doesn't support it, then the 7-column thought record helps people generate an alternative or balanced thought or image to replace their hot thought. Whether the evidence leads you to make an action plan to address a problem supported by the evidence, or to construct alternative balanced thoughts, using thought records generally leads to improvements in mood. As people use the 7-column thought record over time, it helps them build a memory bank of information that they can use to respond to their automatic thoughts that come up in particular situations. In fact, it actually helps people retrain their brains so that eventually, after several months of thought record use, when people have an automatic negative thought, they'll find themselves beginning to have an automatic alternative or balanced thought in response to it. Detailed guidance for you as therapists on how to use the 7-column thought record and teach clients to use it effectively can be found in chapters 4 and 5 of the Clinician's Guide to CBT using Mind Over Mood. So far we've been talking about automatic thoughts, which are the thoughts and images that pop up in specific situations. Beneath automatic thoughts is another level of thought that we call underlying assumptions. Underlying assumptions are conditional if-then beliefs or rules that guide our behavior and our emotional reactions to things. Underlying assumptions are important in maintaining long-standing behavior problems like relationship difficulties, alcohol and drug misuse, and procrastination. They're also the most important level of thought for working with anxiety disorders. Why is this? Because anxiety disorders are maintained by future-looking if-then conditional beliefs, like, if I make a mistake, then people will ridicule me, and I can't cope with that. The best way to test out underlying assumptions is to do behavioral experiments. Behavioral experiments are real-life action experiments that we do in the therapy session and that clients do between sessions. For example, you could practice making mistakes and do an experiment to see how many people in fact ridicule you. You could do an experiment like this. Stand outside a coffee shop and ask 5 people passing by, where can I get a cup of coffee? See how many ridicule you. Maybe 20%, maybe 100%. Then you could do experiments to practice coping with ridicule when you receive it. Behavioral experiments are the best way to find out if our real-life experiences match our underlying assumptions. Clients can use the behavioral experiments worksheet from Mind Over Mood to track their outcomes of their experiments and what they're learning from them. Therapists can use Chapter 7 of the Clinician's Guide to CBT using Mind Over Mood to learn in greater detail how to set up and design behavioral experiments and debrief them to maximize client learning. Core beliefs are another level of thought that we sometimes test in therapy. Core beliefs are absolute beliefs that we hold about ourselves, other people, and the world. Beliefs like, I'm worthless, other people are kind, or other people are cruel, the world is dangerous. We believe core beliefs are 100% true, but they're not. Because core beliefs are absolute, a good intervention to test them is a continuum. Core beliefs tell us to put all of our experiences either at 0% or 100% of a continuum. But actually, almost all life experiences fit somewhere in between. When using a continuum, I advocate therapists use a positive continuum. What I mean by this is if the client believes I'm worthless, make a continuum from 0 to 100% worth. The reason for this is it's a lot easier to help people construct and support new and positive core beliefs than it is to test out and try to unravel and dismantle negative core beliefs. This is also the reason why we encourage clients to keep a core belief record of experiences that fit with the new positive core belief that they're trying to develop. As you might expect, automatic thoughts, underlying assumptions, and core beliefs are all connected. If we hold a core belief, I'm unlovable, then we're likely to have underlying assumptions like, if I go to that party, then nobody's going to like me. And when we're at the party, if we do go, we're going to have automatic thoughts like, she's bored with me, she doesn't want to talk to me, I'm uninteresting. So which level of thought should we test? It's usually best to start by helping clients identify and test either automatic thoughts or underlying assumptions. With depression, we usually start by helping them identify negative automatic thoughts and use the 7-column thought record. Once they get adept at using the 7-column thought record, their depression has usually begun to improve, and we can then move on to identifying underlying assumptions that set them up for relapse for depression. Assumptions like perfectionistic ones. If something isn't just perfect, then it's completely worthless. With anxiety disorders, we begin by identifying key underlying assumptions, and we begin to test these in the first few therapy sessions using behavioral experiments. Emerging research suggests that clients may actually feel worse if we work with core beliefs in the first 4 to 6 months of therapy. And since automatic thoughts, underlying assumptions, and core beliefs are all connected, if we work with the relevant automatic thoughts and underlying assumptions first, the core beliefs often take care of themselves. Remember, there are 3 levels of thought, and different interventions are ideally suited to test each of them. For automatic thoughts, we want to look for evidence in specific situations. For underlying assumptions, we want to do behavioral experiments and see if the if-then predictions come true. And for core beliefs, we want to test these out using a continuum and a core belief record. Good therapy requires continuous improvement. Watch, read, try it out, and get feedback from your clients. If you like this video, give us a thumbs up and press the subscribe button to encourage us to make more. Don't be the therapist who has just a hammer. If you are, everything will look like a nail.